Hello everyone, this is the Spinal Garage, and this is our Postural Correction Core Workshop. Today, we're going to be going over 6 main exercises, 1 for your cervical spine and 5 for your lower back and pelvis. All of these exercises are quick and easy, they require minimal equipment, and should be incorporated into your daily routine. The best thing about this program is you guys get to become an integral part of correcting your spinal misalignment and preventing spinal degeneration. Remember, the reconstructive care program you're going through in our office promotes better posture, better health, and better overall wellness. So you guys should be excited about making this part of your daily routine. Not only is it going to increase the efficiency of your doctor's adjustment, it's going to help you hold your alignment longer, and it's going to maximize the results you get here in our office. You guys should all remember that the main function of our spine is to house and protect our spinal cord and our nervous system. The spine also acts as an attachment site for all of our postural muscles. These exercises we're going through with you today are targeted to make sure your postural muscles are pulling on the spine with equal forces on either side. If our postural muscles are even slightly unbalanced, they're going to pull on our spine with uneven forces and can actually hold our spine in a misaligned position. When your spine is in a misaligned position, it interferes with nerve flow, but it also causes excess stress to the tissues that surround our spine. Our posture is a mirror to the structure in our spine, and it reflects any spinal misalignments. So exercises that are targeted in correcting these postures are also going to facilitate our spinal correction. It's going to take pressure off of our nervous system, restore normal nerve function, and take stress off these tissues. There's a few pieces of equipment you're going to need to go through these exercises. And the first one is a ball like this, an exercise ball. And the other thing you're going to want is a yoga mat. Okay, both of these things can be bought at your local Walmart or Canadian Tire for less than $10. So make sure you have these things before we get started. The other 3 things I want you guys to be thinking about the entire time you're doing all 6 of these exercises. The first one being maintain a spinal neutral position. We're going to go through that in a few minutes about how to find your spinal neutral and how to maintain it. And the other thing we want you to do is make sure you're doing these exercises out of pain. You don't want to be experiencing a lot of pain. If you do, talk to your doctor and they'll give you a modified version of this exercise. And the last thing you want to remember is keep breathing.
Welcome folks to what we call the Camel Stretch, and we're going to thank our model here, Catherine, for joining us and helping us out. So with this exercise, we want to do this first to warm us up for the following exercises. So again, keeping the pelvis even, straight, the shoulders and thorax straight, head slightly pointed forward and up. And what we want to do is start by doing what we call the cat stretch. We're going to bring this back and we're going to bring it up as much as we can to the ceiling, keeping the functional core tight again, which is very important, okay? And hold it for a second or two and then bring it back down, okay, to warm up. And then you're going to go straight through. Push your belly into the floor, okay, which is the camel portion of this stretch. Hold it for 2-3 seconds, bring it back up, and then we're going to go into the cat stretch again. Head is going down with this, holding it tight, core, hold it for 2-3 seconds, and then we're going to go back into the camel again, really stretching that spine. Head is up, okay, holding it and breathing. Keep breathing. Very important exercise to get you into the others. Back up to the cat, and one more time into the camel. Let that belly button go right to the floor and head up. Keep breathing. Thank you. All right, folks, welcome to the bird dog exercise. I want to thank Catherine, our model, again for helping us out today. Starting on all fours, not like we are on the table here for the video presentation, but on the floor. So as she's got her hips and her shoulders squared up, with her head pointing just slightly forward and up a little bit, so you've got a little bit of curve in the neck, eyes kind of forward, but not too hyperextended and not too far down. So we're going to start with a simple, basic exercise of raising the arms and then the legs, and then we'll do an advanced program in this one. We'll do it together. So we're going to start with your first arm, keeping the neutral core, functional neutral. That's good. With minimizing the wobbling, back down, hold it for a second. Good. And now the other arm, we're going to bring it back up. Good. Keeping it steady and down. Just hold it for a second. All right. And then we're going to do the arm again, just so we can show the audience. Keeping it steady, and then back down. And then the other arm, functional neutral, keep it steady. All right. Noticing that you don't want her to rotate her shoulders as she's coming up. Okay. And then we're going to start with the one leg, and we're going to bring it straight across the floor, dragging it as we put it out straight. Let's start with that leg, keeping the core, central, neutral, minimizing twisting, rotating of the pelvis, and back down. And let's do the other side. She should be able to keep her buttocks even as she brings it up and back down. Just sweeping against the floor. All right. And you can see that. So start with the arms, then do each leg separately. And now we're going to do the advanced stage of this, again, without rotating shoulders, without rotating the pelvis, and keeping the core steady with minimal shaking. So we're going to go ahead and do opposites. Go ahead, Catherine. All right, a little bit of shimmering there. Come on back down. Good. And then let's go by the other side. That's it. You're good. Back down. You can see this is more advanced. It requires a little more balance. And let's do the opposite side again. That's better. That's better. Good. Minimizing the rotation here and here. Keeping the head pointed. Come on down. All right, and let's do the opposite side one more time for the audience. Awesome. Building the core, keeping it tight, bring it back down. Thank you. And that's your bird dog. Welcome now to one of my favorites. Might be one of your favorites, the plank, or what we call the bridge. So we're going to do a side bridge first, and then we're going to show you a modified and advanced of that, and then we're going to go on to show you a front bridge or plank and a modified and advanced version of that. So we're going to start with the side bridge or plank, as we call it. And with Catherine, we're going to do the modified first with the knees touching. So we're going to come up, keep your spine straight. Your knees could be down, touching, keeping the elbow and shoulder in line, okay? So she's doing that, and she's holding this, and again, keeping functional neutral. And this is a really tough exercise. You want to hold it for 5 to 10 seconds, and then let it relax, okay? And keep breathing. So we're going to do that one more time. Show the modified. Up, keep breathing, keep functional neutral. You can see that she is straight across here. The hinge point is her knee and her elbow. Her elbow is in line with her shoulder and neck. And then the next step we're going to do is going to relax, and then we're going to go into a more advanced version of the side. Again, holding for 5 to 10 seconds. You're going to come up with only your heels and toes, your foot touching the floor. And she's holding that. Good, Catherine. Holding that. Keeping this in alignment as much as you can. Keeping this as straight as you can. Keeping that shoulder there, not too far out or too far in. And again, relax, 5 to 10 seconds. There you go. As you get better at this, you can increase it by 5 to 10 seconds as your body. You're going to see a little bit of shaking there, normal, okay? But this is something that's going to really challenge that core, the obliques, everything inside of here. So next we're going to go to the front. You want to do this, flip it from one side to the other. But we're going to do the front, that's the side plank. What we're going to do is we're going to start, she's on her front, and we're going to come up and do the variation where we're going to do a modified on her knees. The key thing with this is, come on up a little bit more, okay? And we're going to hold that. You want to be able to draw this as a plank right across, but keeping a slight arch and keeping this in functional neutral. She's on her elbows, head just slightly up, okay? Keeping this square, and she's on her knees, and you want to hold this if you can for 10, 15, 30 seconds if you can, all right? And again, each adding 5 to 10 seconds as you progress with this. Keep breathing, keep breathing. Key thing here is you don't want to have a teepee where it's up, and you don't want it to be sagging. You want to have a plank right there, okay? So you can relax now. That's the modified version. The advanced version of this is going to come up on your toes, and the whole thing is going to completely be a plank, and that's why we call it a plank. So Catherine, go ahead. Keep your functional neutral. Bring your bum up a little bit more. You can see you can draw a board across there. She's holding it. You're going to shake and shimmer a little bit. That's okay. You're challenging yourself. There's a difference between you feeling the tightness and uncomfortableness, and there's a difference between hurt. You don't want to hurt. And you want to keep breathing 15 to 30 seconds. You're doing great, and then let it relax. Okay? Another thing you can do with this, you can go from a modified, your knees, to an advanced, relax in the modified, knees to advanced. So you want to show her that. Okay, so I'm going to get you on your knees, do the modified, and now we're going to go up into advanced. Hold it. Let's say she held it for 15 seconds. She drops down her knees, maintains the plank. She's resting a bit, but maintaining that plank. And then you're going to go back up into the advanced. Okay, and just another variation of this tough exercise. Thank you, Catherine.
So this exercise is known as the dead bug. And this is great for people with chronic low back issues, as well as looking to stabilize their whole core. So what we're going to do with this one is we're actually going to start by finding functional neutral. And this is the neutral part of your spine. So how we're going to do this is we're actually going to get Catherine over here to push her back all the way, flatten her back all the way into the mat. And then she's actually going to go the opposite way and actually push all the way out. And we want to see, that's it. So you can almost put your hands underneath. And then what you want to do is you want to find the middle part of both of those. And just so you feel comfortable. You shouldn't be in any pain at all when you do this. From here, you're actually going to brace your spine. So we actually want you to brace. And what I mean by bracing is I don't want you to hold your breath. You want to keep breathing. But if I were to poke your stomach, then that resistance that you'd feel is actually is what we mean by holding. So I want you to hold that position for me. And what we're going to do is we're going to start at the first step. And the first step is to go to the legs. And what we're going to do is we're going to get you to lift up this heel first, but only a smidgen, just a little bit off the ground. Very good. And putting it back down. Very good. And what we were looking for in here is to see if there's any pelvic sway or dropping of one side or having to struggle with that. If that was the case, then I would actually stop there and only work on that transition. So we're going to get you to now go onto this other side, looking for any pelvic sway. Very good, and back down. She did that very well. Everything was nice and level. So from here, we would actually move on to the next step. To the next step, we're going to work on to the upper part. And what we're going to do is we're going to get her with your right arm. I just want you to reach back as far as you can. Very good. And what we want to look for is the rib. We want to see if that's lifting up. So I want you to come back down. This time, again, I'm just going to kind of get her to go. So we're going to hold that position. Very good. Holding that. Keep breathing and bringing it all the way back. Breathe in. That's it. And all the way out. Breathing out and bring it down. You got it. Perfect. And she maintained that a lot better. And that's exactly what we want. Now we would do that with the other arm on this side. Very good. Looking for that. Good. She maintained that quite well. Keep breathing. You're doing great. And back down. And then the last one is doing both of them without flaring the ribs. So again, both arms together. Very good. And back down. So if you can do this without pain and maintaining that structure in there, then that's actually good. And then you can move on to the next one. If you can't do that, then I would actually stop here and just focus on those two. The next one we're going to do, the next progression, is we're going to get one leg down. So if you just extend out this leg, and I'm going to get you to extend out this arm. From this position, this lengthened position, we're going to get you to come back in, okay? Almost like a crunch, okay? So again, just bringing your knee and your arm together. Good. Meeting in the middle. Awesome. Breathing out when you do that. And then breathing in as you extend out. So breathing in as you extend both of your arms out and your leg. That's it. Awesome. Maintaining that core pressure. There we go. So let's try that again one more time. And bringing it in. Good. And out. And now she maintained it. Great. So then we would repeat that on the other side. The last step, and the hardest step to this whole thing, is really where the dead bug gets its name. And so what we would do is we would lift this up to about 90 degrees, actually both sides, keeping this 90 degrees, and then your hands are going to go out in front, hence the dead bug. Okay, so this is where it gets its name. Again, we're going to maintain the core quite tight, holding, bracing that position. We're going to keep breathing. We're not in pain. And what we're going to do is we're going to separate this arm from this leg, extending as far as you can, okay, without moving anything else. So I'm just going to help her just to get started so I can get you extend. Very good. And come back to the middle. Very good. And then switch. There you go. Now this is quite hard. She's making it look quite easy, but this is very difficult to do, and you're really going to feel that struggle even within your brain to see which side you can go with. Again, let's just try that again. Awesome. Good. Really maintaining that core. There we go. And then the other side. Very good. And back. Very good. So that's awesome. What I would do is we would actually do this as a daily routine, but you'd only do this about 10, 15 times in a set. And then from there, if you need any more help with that, please ask us. This exercise is the ball squat. And the reason why we're doing this is also to strengthen not only the core, but to actually help maintain that whole stability in through the ground up. So what we're actually focusing on is also the glutes, okay, as well as maintaining that core structure. So for the average person that does a squat, what we're looking for is we want to see that you're actually standing nice and straight, you're nice and relaxed, there's no tension in through the shoulders and through the neck. But the other thing is you always want to maintain that your feet are actually shoulder width apart. And so most people, when they start, they would actually start this way. The only issue is when you come down and just do a basic squat, your knees are going way too far over your toes. And we don't want this. It causes too much anterior shear of the actual femur on top of your lower leg. So what we're going to do and to change this up is we're going to get Catherine here to step out and almost be like she's on a complete angle. So you're going to start off weird, but you're going to finish strong. And so in this position, she's well supported because there's the ball in the back, so you're going to feel the ball rolling up and down your back. It's actually going to be quite comfortable. And what you're going to do is maintaining this position, the feet shoulder width apart. All I'm going to get her to do is to go to about 90 degrees, almost as if she's sitting on a chair. So she's going to come down. Very good. Holding for a couple seconds and then coming back up. Very good. And all you're doing really is you're focusing on just rolling that ball up and down your back. Okay? So from this angle, the main things that you want to look out for is you want to make sure that A, your knees are not coming in front of your toes, but also that you're not flaring your knees outwards as you're doing the exercise. Everything is in perfect harmony. So let's do that just one more time again, keeping everything nice and straight. Very good. And then back up. Awesome. Perfect job. And I would repeat that about 10 to 15 times, really making sure that as you're in that lower position, you're actually squeezing your glutes in order to rise up, okay? And that's going to really what's going to want to hold that position. This is an example of what you don't want to do. So if you were to stand straight up, you can see that her knee is coming way above her toes. And we don't want this. This is going to strain your knees, and you're basically setting yourself up for a long, painful ride. What we want to do is we want to have that nice angle in through, stepping away, almost feeling like you're leaning back against the ball. And that way, when you come all the way down, there's no way that your knees could ever pass your toes. So that's a good one, and that's a lot easier.
Hello, folks. Welcome to what we call the chin tuck. Okay, this exercise is not a direct core exercise on your core. This is an exercise mainly for your neck. What we have in our daily posture nowadays, whatever we do, whether we're at work, sitting in front of a computer all day long, is that these muscles, these front muscles, become weak and tight. And what we're trying to do is do the opposite by working, stretching them, but also strengthening at the same time. So we'll start with the chin tuck. This can be done anywhere. It can be done at your desk, it can be done in a chair at home, at the kitchen table, even in your car at a red light. Just keep an eye on the light. So when we're doing this, we're looking straight ahead. We're in a comfortable sitting position is the best way to start this. And what we're going to do, Catherine, is again, find your neutral where you sit normally, where it is, so you have a reference point. And now what we're going to do is we're going to translate your head straight back. And the more double chins we can create here, the better. For some of you, you can relax, you hold it for 5 seconds and let it go. You may be able to move a half an inch because the scar tissue and damage is in your neck, but eventually you're going to be able to translate it back 2 to 3 inches, just as Catherine's doing. Go ahead. Excellent. Good. Again, let's hold it for 5 seconds, working on those muscles. Keep breathing, keeping your posture right. Excellent. Okay? And what we don't want to do with this exercise is we don't want to do tilting. So I want you to tilt by doing it. That's the wrong exercise. What we want to do is we want it to be a straight translation back with the head, like you're pushing it into a wall. And again, you can put your finger there to monitor how far back and how far you're progressing each time you do it. You want to hold for 5 seconds. You want to do it for 10 times. And then as you progress from there, you can hold it longer and certainly do it more times throughout the day, anywhere you are, sitting at the office, chair and desk, or even in your car. The advanced version of this can be done when you're laying down. And this is to further strengthen those muscles while you're doing that chin tuck, okay? So Catherine, we're going to demonstrate that next. We do this lying down, knees up, just to keep more stress off of your spine, but also enables us to keep a functional neutral even while we're doing this neck type of rehab exercise. So Catherine, what we're going to do is going to do a chin tuck. Let's do that. Tighten it up, push your head back, and then we're going to raise your head 5 to 10 seconds, holding it there, but 1 to 2 inches off the table, and then relaxing it, okay? As you get more advanced with this, you can hold it certainly longer, increasing it by 5 to 10 seconds at a time. Let's try that again. Chin tuck, double chin, raising it 1 to 2 inches off the floor, increasing the strength and flexibility as well in that neck as she's doing it. And keep breathing. Let's do it one more time. Chin tuck, just like you were doing when you were sitting, but then just raising your head 1 or 2 inches off of that floor. All right? Thank you.